So we're starting chapter 11, which is about health insurance, disability, and long-term insurance. So long-term care insurance, you're probably not too worried about that right now, but you should be concerned about health and disability insurance. So there's your learning objectives. So in terms of, these aren't on your notes, which is fine. I just kind of want to give you a little bit of background information. The U.S. has the highest per capita medical expenditures of any country in the world, so not real good. There's our average cost per capita in 2019, $11,000, and we spend about twice as much as other, highly developed countries. So not good. There's a lot of different reasons why that is the case. We're not going to really go into that. But we're looking at about 20% of our gross domestic product is just dealing with healthcare. And it's going to grow from 3.9 to 5.7 in just a few years. Yet about 32 million people have no health insurance in the United States. Now, that number has come down a little bit in recent years, but it's still pretty high. And if you look at our healthcare, our administrative costs compared to, say, health to Canada, it's quite a bit higher. I'm not saying that Canada has a better health system, but there are just some things that do look pretty bad. And we often think, we're pretty healthy here. Here's a chart I got just to show you. It's kind of interesting. Percentage, just kind of relating people's health. People that smoke, percentage of the population. So that's pretty good. We're in the yellow. We're all the way over here out of top 11 major countries, industrialized countries. So France, a lot of smokers. United States, not as much. Alcohol consumption, United States kind of right there in the middle. Obese, United States by far number one. We're looking at a rank of 70 compared to Japan as 23. So this causes a lot of our health problems. Now look at the life expectancy. In total, at birth, health adjusted for everything, we're in last place amongst all of these countries. Maternal and infant health, so you don't want to be on this end right here. These are deaths per live birth. So infants die more. So it's not a really good testament to the healthcare situation in the United States. So we're spending a lot more, and we have a lot more people dying relative to other countries. So not the best situation. So here we have the uninsured in America. So in the red is the not insured, and your age group is the highest because you're the healthiest, and a lot of people, and also probably the least able to afford health insurance. So those two factors make that number pretty high. As you get older, of course, you definitely need health insurance more than if you're younger, and so on. So how can you, because this is something that really is practical for all of you, I know a lot of you are going to be graduating soon, and you're able to stay on your parents' health insurance for a number of years more, for, I don't know, depending on how old you are, I think it's to like 25 or 26, they might have raised it to. And that would help potentially lower your health care costs. But you also will probably be getting a job, and if you're at a job at a fairly decent sized business, they will be providing health insurance. So you just have to determine which is the better route to go. But regardless, what are some of the ways that you can reduce your cost? So remember, we've talked about this with like your car insurance. To reduce your deductible raise your deductible will reduce your cost. Always make sure you're getting the generic drugs. I shouldn't say always, but try to get the generic drugs. They cost a lot less. And I want to mention this. I think I've mentioned this before. The app GoodRx, I've used it quite a bit. If you don't have it, get it. It's free, and it can save you sometimes on medications. Sometimes you can use a mail order pharmacy. Just depends on your health plan. So for long-term drugs, try to just get a mail order, and a lot of times it'll be less expensive. make sure you investigate non-urgent procedures. So meaning, you just didn't have a heart attack, but you have to have some sort of procedure done. It could be done this year or next year. Just investigate to make sure, do you really need them, one, and where would be the best place to do it. There are errors sometimes on your bills, so check those. If you think there's a situation where it's really unfair, and I've seen people have this happen to them, where they thought the surgery was going to cost maybe $10,000 and it ended up costing $20,000, and the doctor just didn't really explain everything, and so they've had to appeal it. And of course, just try to be healthy. So, excuse me. So health insurance reduces the financial burden. So that's why we're talking about it in personal finance, because it can impact our economic security. And health insurance includes both medical and disability income. So we'll talk more about disability later on. Medical expense, I think, is pretty evident what that means. Most people don't realize this, but group plans, meaning when you work at a company typically, is where most people, 90%, get their health insurance. So the employer often will pay part or most of the cost. So where do we get health insurance? Individual health insurance, meaning you don't get it through your group, or you can get it through your group insurance. So you can have your own insurance, and you can supplement it through group insurance. So you can actually have two health insurance companies, because maybe your company doesn't have the best insurance and you have some serious medical needs. So you can get your own health insurance. Okay? So they have what they call coordination of benefits, meaning that if you have, say, a surgery, you're not going to collect twice from both firms and then be able to pocket the difference. So you're only limited to 100% of what was charged. So let's say you were married, you got divorced, and you were covered under your spouse's employer's plan, and you got a divorce, so now you don't have health insurance. Well, you can still be covered under what's called COBRA. Okay, so that's an important thing to know, and it stands for some ridiculous kind of term there. You can read it, but it basically means that if you lose you lost your job, that you got laid off, you don't have to lose your insurance. Now, what you would lose is what the employer pays for your health insurance, and you would have to pay it all on your own. But you still would probably be able to get a discount compared to if you just went to buy the insurance on yourself, by yourself. So COBRA allows you to continue coverage up to 3 years. It depends on other factors, typically 18 to 36 months, and also the company that you have to be working for, I believe, has to have about 20 employees to be covered. So in terms of what a good health insurance coverage should look like, you can read there on your handout, offers basic coverage or whatever. It should provide at least $1 million lifetime maximum for each family member, and pay at least 80% of the out-of-hospital expenses. Limit out-of-pocket expenses to $4,000 to $6,000. So that's kind of a good, what we would consider a good plan. So some different types of medical coverage. Major medical covers serious injury or long-term illness. It has a deductible and co-insurance and so on. And then you can just, the rest of them there are pretty straightforward. Here, dental and so on, vision. So it's just an example of how it would work. So, you know, if you have an $800 deductible and your total bill is $3,800, then that means 3,000 is what the health insurance company is looking for in terms of how much of the percentage of the bills they have. So you typically have what's called co-insurance, and in this case, if the company pays 80%, they pay 80% of the 3,000 or 2,400. So out of the $3,800 bill, your insurance company would pay 2,400, which means Ariana would pay the remaining 1,400. So that would be your blank there, 1,400. The long-term care insurance, something that maybe your parents are getting or your grandparents are thinking about. A lot of people will buy this maybe like when they're in their 50s. The earlier you buy it, the cheaper it's going to be, of course. It's one of the fastest growing types of insurance. A lot of that's because we're living longer. Well, because of COVID, we lost a year, but I guess. But anyway, we're living longer in general. And it's estimated that more than half the population will need long-term care at some point, whether that means having a home health nurse come in to take care of you in your own home or going to some sort of facility. And it can be very expensive because it can be very costly to be in an assisted living home, which you're talking like $7,000-8,000 a month right now. There it is. National average of 1 year in nursing home can be like $97,000 just for 1 year. So your annual premiums can get very, very expensive. So this is a TED Talk I'd like you to listen to. It's only 10 minutes long, and there'll be a couple questions on the quiz regarding it. This will be posted in Blackboard under chapter, I'm not sure, under the folder for your quiz 3, under chapters 11, 12, 13, 14. So watch that, kind of interesting. So in terms of getting health insurance, some of the things they look for in terms of being eligible would be, you know, for example, are you married to the person that's buying the insurance? So it's a family policy. What are the ages? A co-payment is typically about $25 I've seen, and that's just when you go to the doctor or any healthcare facility. You will typically have to pay that co-payment regardless of what happens. Sometimes your service benefits are you're entitled to, they'll say, okay, you can have this procedure and we don't give you an amount. Other companies will say, okay, look, we're going to give you an amount for a procedure where you can go wherever you want. And then, of course, depending on how good your health insurance is, they'll say, here's a number of days you can stay in your hospital. So you may hear cases where you know somebody had some sort of procedure and they were able to stay in there for like 2 days, and others are maybe able to stay there for 3 days. So in terms of where you get your health insurance, some are just private insurance companies. That's if you went out and kind of bought it on your own, or it could be a group policy sold by an employer, or you can join what we call an HMO, Health Maintenance Organization. And there's kind of like a couple different types here. So you have a prepaid health plan, and you have what's called, I mentioned a minute ago, HMOs and PPOs. So with both of these, you have a primary care physician, and contracts are with selected care providers. So if you want treatment for something, you can only go to doctors or hospitals or health organizations within a certain network. And you have a fixed prepaid monthly premium, and they're really focused on preventative care. So let's try to, make sure you don't get sick in the first place. A PPO is biggest difference is you have several providers to choose from as opposed to one provider, and that's why it costs a little bit more than an HMO. If you go to a non-PPO provider, you can do that, but you're just going to have to pay more. So here's a chart I grabbed, HMO kind of versus PPO. The premium is a little bit lower cost than the PPO, and here's the choice of providers. Notice it's a little bit less than these providers. So you pay less, but you don't have as many choices. So I mean that makes sense. So other options, if you get sick and you need help and you can't stay in a facility, you can get home health care. Hospice, for those of you who don't know, hospice is a service that basically means if you ever hear somebody saying we're calling in hospice, it 99% means that person is going to be dying probably within the next month, 2 months or so. And so they're just there to provide, comfort care, we call it, so that they're not in pain. So government healthcare programs, and this is not something that you're going to be dealing with right now. Your parents, your grandparents might be doing this, but all of you will someday have Medicare, and that's for those that are 65 or older. And it's 65 because that's when typically most people retired. Now that age is getting older and older, but they said, okay, when you're at 65 and you're retiring, you no longer have a company that can provide you health insurance. So part of, if you ever notice on your payroll, taxes that are taken out, part of your taxes go to Social Security and part of it goes to Medicare. It's a very small percentage, about 2%, but all of that money that you've been paying to the government for all of those years of working is going to provide you health insurance for when you get older. Now, it's not necessarily, Cadillac of one of the best insurance policies, but it provides a lot, and a lot of people get supplemental insurance to it also. But anyway, they have different parts like A, B, C, and D, and once again, don't need to get caught up in that right now. But there's hospital insurance, medical insurance, there's prescription drug benefits, and whatever. So they have a lot of different parts to Medicare. So there's Medicare and Medicaid. Big difference. Medicare is for everyone. Medicaid is for low-income individuals and families. And so this is, you don't have to be 65 years or older. If you're living in poverty, you could be 20 years old and you can be on Medicaid. So it's kind of a form of government-assisted health insurance. And the last thing is disability income insurance. It's something that all of you should think about. And I know most of you are going to be in white-collar jobs, and chances of getting injured are probably going to be pretty small. But if you're if you're working in a construction job or something, you really should have disability income. And it says that disability income insurance protects you from your most valuable asset, your ability to earn income. If you are hurt and you cannot get a job, then that is detrimental to your earning power, of course. We're more likely to be disabled than death at any age. So they're just saying we're all, of course, going to die. You may never get disabled till you die. But they're saying, okay, if you're at 50, what are the chances of dying? What are the chances of getting disabled? So typically it's more chances of being disabled. So it provides regular cash income because of your loss of ability to work. You can get money to come in. So it differs from health insurance. Health insurance to pay your medical bills. This is to give you an income since you can't work. So as you already know, that if you become disabled, your income drops, but your medical expenses go up. So there's a couple different definitions of disability. It depends on your policy. Some policies define it simply inability to do regular work. So good disability plans pay you when you're unable to work at your regular job. And then poor disability plans pay only when you are unable to work at any job. Okay? So I know that's a little bit hard to to understand. Just read those again, just very slowly, and I think it'll make sense. Places that we get disability income, your employer typically has insurance that pays for that. Most insurance limit benefits to no more than 70 to 80% of what you make, which is still better than, I mean, that's 80% of your salary would be pretty decent. Also, Social Security, the federal government, covers total disability that lasts more than 12 months, and you must be unable to do any work whatever. Okay? So they're saying if you're not going to be able to work for over a year and you're totally disabled, then Social Security will help you out with some of that. There's also what we call workman's compensation. Once again, your employer pays into this, and it applies if there's like an accident at your place of work. Okay? So it's very similar to kind of what we have up here, and it's resulted from the type of work that you do. Okay? And that is it for chapter 11.